I feel the only thing that I miss is fizzy drink.
Fizzy
But
drink.
that's the worst thing. 106, 107.
You don't show a kilo over 70. Yeah?
It's been nice to get to know you all, meet everyone. We've got a love of tea.
Yeah. Hello everyone. Welcome to All About Health, the show in which we speak of all things healthy. Today I'm here with Miss Michelle Boyle. Welcome, Michelle.
Hi.
How have you been?
I've been good.
You've been here for a long time, yeah?
I've been here, this is day 5.
5 days ago you had a surgery.
Yes, I got the Mommy Makeover, tummy tuck and liposuction.
Okay. So this is a lot of work, isn't
Yes.
it? Yeah.
So 3 days after surgery.
But you're looking well.
I feel really well, yeah.
You're not only a patient who's done a plastic surgery. We have a longer relation with you.
Yes.
Let's take it all the way back to September.
I came on the 28th of September last year, exactly 9 months ago, and I got a gastric sleeve and I got to my ideal weight, and I just decided to get back in touch with the team as I felt so confident, carry on with my journey, the next part of my journey.
So the gastric sleeve you did last September. Did it take 9 months to reach your ideal weight, or were you faster?
That was about 9 months because I kept having stalls and then lose and then. Yeah.
I see. Because weight loss is never a linear thing, right? They
Yeah.
always say it has its ups
I'm
and
not
downs.
very sporty either, so it probably took a bit longer.
But still, 9 months is a good time.
Yes.
And you've started off with how many kilos?
106, 107.
You don't show a kilo over 70. Yeah? So it took you some time to reach your ideal weight, and then you said maybe I do over my skin, I do over my breasts, and came back for a surgery.
Yes.
So how did you get in touch with Dr. Hassan's team back in September?
I actually researched it myself, just through what clinic and things like that. I just found someone that I felt attracted to. I didn't want to go with anybody's recommendations. I just wanted to feel like I'd picked someone myself, and I felt a connection. I liked all the reviews, and I felt confident to come.
And then September you were here,
Yes.
and you were here with
My friend's mum.
your friend's mom.
Yeah.
And she also had
She had the same surgery. She's getting on great as well. She's at an ideal weight now as well. Yeah. So
Kudos to both of you.
Yes. She's a bit older, so she's not going to continue any plastics.
I see.
But I'm talking her into getting her teeth done. So.
Oh, okay, okay. Well, we'll go visit the dentist tomorrow, yeah? Maybe the next time we see you, you're just coming
I'll
as
bring
our
her
friend.
along, yeah.
After you booked with Dr. Hassan, we saw you at the hospital. You were there for 3 days, and then you stayed a while at the hotel, and you were back to the UK.
I stayed at the hospital 3 days and just the hotel 1 day. And then I just went home. I booked an early flight because I felt totally fine. So I just stayed 4 days.
You recover well after surgeries.
I felt 4 days was long enough.
And now it's 3 days and you're already up on your feet, walking.
Yes.
How did you decide to do the plastic surgery afterwards? After you're losing weight, was it an instant moment?
I think it was always going to be a thing, the breast thing for a reduction. And when I was looking into it, I just thought, I like the sound of the whole package getting done all at the one surgery.
So then you don't have to go back, return every time. And it takes time to reach the final product, right? It's just like obesity surgeries. You do the surgery, but it's not instant.
It's going to be over 6 months.
6 months.
Because you'll get a lot of swelling. Like I feel like I'm a bit swollen just now, but that's just water retention. That's all been explained.
In the first weeks, just like the weight loss surgery, you're going to be losing the edema and losing a bit of weight.
Yeah.
So another question for you, Michelle. After the weight loss surgery, what things changed in your life? What new things you had, or what old things did you lose?
I feel the only thing that I miss is fizzy drink.
Fizzy drink.
That's the worst thing. Like everything else that's changed has not been any effect to my life because the gains I've had, the positivity I've had with all the other changes has outweighed all the other things. I can still go out for meals. I just order a kids portion. Or if there's not kids portion, I'm one of these people that say, can I take the rest away? And I'll eat it for my lunch the next day or
you
something.
Find someone on the table, can we share?
Yeah. It's so easy. If we're doing a cheat day and the kids are wanting burgers or whatever, I'll order a kids meal and I'll share it with the kids just to have a tiny bit of, which is really bad. But I feel like my life needs to be living. It can't be structured 24/7. So maybe I have 1 or 2 days off a month where I say we're having a family day out. Where I eat naughty food, not a lot.
And already, the plans presented to you here weren't that strict. They were like, you will cheat every once in a while, but it's better to stay on track.
But you know what? When you're seeing changes to your body, you don't really want to cheat. Yeah.
Because you're seeing the benefits, yeah? But fizzy drinks, you used to love them?
I used to love a can of fizzy drink, but now I've never had one since.
Okay.
I've never been tempted.
Yeah, that's good.
That's probably why I'm like, I miss that.
How was the reaction from your loved ones to see you losing weight that fast? How did your kids react when mom's becoming half the size?
They're still quite young. My kids are 4 and, well, my daughter was 3 until a couple of weeks ago. So she's too young to understand. But my son, he's 8 and he always says, oh, Mum, you can do so much more now. I love how you can come on the slides at the park, the adventure playgrounds, where I go down the slides and I'll race him. I would never do that before. I'd be the one holding the handbags. I'll watch the coats, but now I'm involved.
Good. You're becoming the active mom.
Yeah.
And after this surgery, after the plastic surgery, what's going to change? What's on the horizon?
More confidence.
Of course.
More confidence.
You have a self-confidence and you walk upright and you...
That's what I want, yes.
So we're looking forward to see how you look after
by
6 months.
Christmas, I should be...
Yeah, by Christmas.
That's what my goal is.
Okay, so you're organized that way. First surgery in September, and by Christmas you can already start eating solid foods, and then the next surgery, and then by Christmas you're looking like your real self.
Yes.
Thank you so much for your time. It's been wonderful having you here and at the other hospital for your sleeve and the plastic surgeries.
It's been nice to get to know you all, meet everyone. Yeah. We've got a love of tea.
Yeah. Thank you so much. This has been All About Health with Michelle, and from our part, goodbye.
Bye.